Jennifer, my name is Megan. I'm going to be working with you today and trying to help you understand exactly what the vocal folds are, where they're located, and what the papillomas are doing to your vocal folds. So first I'm going to try and help you understand where the vocal folds are located. So if you touch your neck right here, you're going to feel some lumps, and those lumps is your trachea. So right on top of your trachea is the larynx, and the larynx is what most people know as the voice box. And right inside the voice box is your vocal folds, and that is what helps produce the voice. And if you put your hand on your neck when you're speaking, you can hear the vibration of the vocal folds in the larynx. So I'm gonna go ahead and draw it out for you so it's easier to understand. So right here is the trachea, that's right here. Right on top is the voice box, and inside are the vocal folds. So the vocal folds at rest, they remain open. So you can allow air in and out, which allows for you to breathe. So air goes in and out, and it goes in and out through the trachea. So now what the vocal folds do, is they remain open, just at rest to allow for you to breathe. Now when you need to talk or when you swallow, the vocal folds, they close. And in order to produce voice, the vocal folds open and close, allowing air in because you have to breathe while you speak, and allows you to produce a voice. So what you have on your vocal folds are called papillomas, and they're little nodules that are just on the vocal folds. And you can have one, you can have several, and they can be any size, big or small. So what the papillomas do is they prevent the vocal folds from completely closing or completely opening. So this, if they don't close all the way, is hard for your voice to produce, which causes different voice qualities. It can make your voice hoarse and raspy, it can make your voice breathy, and it can also give you some different pitches and pitch breaks, and you can sound kind of squeaky, which is what I hear is what you are experiencing. So because the nodules, the vocal folds don't come to a close all the way, so they have some slight opening, which is allowing air to pass through. So they are also causing the vocal folds to swell and become bigger. And when the vocal folds become bigger, that causes the hoarseness and the roughness of your voice because they are not closing all the way, and it's putting a lot of stress on the vocal folds because they want to open and close, but the nodules, so the papillomas and the swelling of the vocal folds are not making that possible. So the papillomas can also, if they are too big, they can cause air to flow through while you're speaking. And this can cause a breathy voice because air is escaping at all times because they are not fully closing like they should. So the papillomas that you have, when I was looking at your picture of them, you have some big ones and you have some small ones as well. So when they get bigger and bigger, they can completely close off your airway, so it cannot close at all, and it could also fill the airway, so it cannot open, which will not allow air to come through. And the doctors are very concerned that if they get too big, you will not be able to breathe and the airway will be completely closed off. So we don't want that. So that is why we want to have the surgery done so that they can be taken out so that your airway is not compromised at all. Do you have any questions? Does that make sense? So it's right on top, and they have to open and close in order for you to speak, and without the opening and closing because of the papillomas, it's causing different voice qualities and also causing difficulty with breathing, shortness of breath, and also breathy vocal quality.